Hello, my name is Dr. Dewan S. Raja. Today I will discuss about prolactinoma. What is prolactinoma? Prolactinoma is a benign tumor of the pituitary gland. It is not a cancer. It is not a malignant tumor. It is a benign tumor that produces an excessive amount of prolactin. The pituitary gland is a small gland located at the base of the brain. It is located on the pituitary fossa inside the sella turcica on the upper surface of the sphenoid bone. It plays a crucial role in regulating various bodily functions by producing and releasing hormones. So pituitary gland has multiple hormones like that of the adrenocorticotropic hormone, the thyroid stimulating hormone, also the follicle stimulating hormone, luteinizing hormone. So many hormones are coming out of the pituitary gland. One of them is prolactin that is coming out of the anterior pituitary from the lactotrop cells. The main purpose of the function of the prolactin is initiation and maintenance of breast milk production, but it is also essential for the reproductive health of both male and female, particularly for the follicle stimulating hormone and the function of the luteinizing hormone along with the hypothalamus. It is a 198 amino acid polypeptide hormone secreted solely by lactotrop cells of the anterior pituitary. Both men and women have prolactin in their bodies. It serves various function. It serves various function in men and women. Okay. So it is not only prolactin is not only present in female, it is also present in male, but prolactinoma is more common among the female. But male may have also prolactinoma. So prolactinoma causes high blood level of prolactin. We call it hyperprolactinemia. But hyperprolactinemia is not only caused by the tumor of the anterior pituitary. It is also caused by many other reasons like physiological. During pregnancy and breastfeeding, we may have more secretion of prolactin. Drug like phenothiazine, haloperidol, these are antipsychotic drug. This drug increases the blood level of prolactin. Prolactinoma itself is a tumor of the anterior pituitary. It may be macroadenoma or maybe microadenoma. Macroadenoma when it is more than 10 millimeter in diameter. Pituitary stalk compression may also increases the blood level of prolactin. Hypothyroidism may lead to high blood prolactin level. And symptoms. These are a few symptoms. We'll go to the other slides. Female menstrual irregularity, infertility, dryness of the vagina. It may be dyspareunia. Male erectile dysfunction, galactorrhea, compression effect, bilateral temporal hemianopia because of compression of the optic chiasm. Okay, this is the brain. This is the undersurface of the brain. This is the pituitary gland. It may undergo tumor, particularly the lactotrop cell of the anterior pituitary. Here we are seeing the tumor. Okay, this is an abnormal mass of tissue, and it is present on the pituitary fossa of the sella turcica of the sphenoid bone. Okay, this is large enough, and this is the sphenoid bone area. This sphenoid bone is This is the cavernous sinus. Okay, we'll not go there. This is the bone here. This is a sphenoidal sinus, sphenoidal bone. Okay, and it is here, and it is related to the optic chiasm. So the tumor may block the optic chiasm, may lead to bitemporal anopia, so lateral field of vision will be lost on both eyes. So this is the MRI. This is the prolactinoma tumor. It should be just a pea-shaped structure, not so large like this. And this is the certainly sphenoidal sinus, and this is a good idea to show that it may need surgery. So you can approach through the nose, go through the sphenoidal bone, then we take out the prolactinoma tumor. Okay. Prolactinoma causes hyperprolactinemia. It is one of the causes we have just discussed. It may be physiological, it may be due to drug. This can result in a range of symptoms including irregular menstrual period in women, may lead to amenorrhea, dryness of vagina, maybe dyspareunia, galactorrhea, abnormal breast milk production in women who are not pregnant or nursing. Even if the male has prolactinoma, they may also have galactorrhea. They may also secrete the milk from the male breast. Infertility or difficulty becoming pregnant, erectile dysfunction in men, decreased libido, sex drive in both men and women, headache, vision problem. If the tumor presses on the optic nerve, actually we have to say not optic nerve, we can say the optic chiasm. That may be more appropriate to say this is optic chiasm in the optic nerve. Okay, it is chiasm. In optic chiasm area. Okay, we got that. Now we'll go to the next slide. Prolactinoma is generally benign or slow-growing tumor of unknown cause. Most prolactinoma are not cancerous, but they are typically not associated with other tumors of the body. There is no association with other tumor, usually not. Workup, what we'll do, we'll assess the serum prolactin level. Its secretion is pulsatile. It should be repeated test is essential to find out the exact serum prolactin level. If it is very high, then certainly it may be a case, then it should be, not certainly it should be a case of prolactinoma or other causes of hyperprolactinemia. Serum thyroid releasing hormone level should also be assessed. Visual field study, because of obstruction to optic chiasm, we may have bilateral hemianopia. Treatment for prolactinoma often involves medication such as dopamine agonist like bromocriptine and carbargolin. Bromocriptine is also tolerable during pregnancy, and it may cause nausea, vomiting, and nasal stuffing. Carbargolin, this is another dopamine agonist, is little bit costly, but it has long half-life, which help regulate prolactin level. In some cases, surgery may be considered, particularly if the tumor is large and causing significant symptom. Surgery is the intranasal transsphenoidal hypophysectomy. We take out the entire pituitary gland through the nose, going through the sphenoid, sinus sphenoid bone. Regular monitoring and follow-up with a healthcare provider are important to assess the response to treatment and manage any potential side effect. Okay. So, in addition to the surgery, we have also other management, like we may have irradiation, because it is not possible to take out the entire pituitary tumor, so it may need radiation and follow-up. Okay, so this is the intranasal transsphenoidal hypophysectomy. Okay, so this may go through a tumor, and we will approach to the nose to the nasal cavity, to the sphenoidal bone. We break that sphenoidal bone and take out the tumor out. And that's all about prolactinoma and also hyperprolactinemia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.